Coming up.
And so, and then it's hard to digest because you go and you're like, okay, no, I'm fine. But the person that I am, I'm like, okay, well, if this doctor says no, and he says expansion and surgery, why would he say that? And so being curious, I dove into researching more about like appliances. I went through like looking at the Alpha appliance. There was also the DNA appliance that I was looking at. There was also like he was also mentioning like maybe doing appliances for pulling the jaw forward so that I could sleep better at night. All of the options, all of the options. So um, I didn't feel like I wanted those, like this is
Yeah.
because he was honest. He was like, at the end of the day, he goes, I'm just being honest with you. It's just going to band-aid your symptoms and it can temporarily fix, but because your structure is damaged and your structure is really bad, you're going to need to have surgery. And then so that was definitely echoed on and on throughout that whole situation.
We have a special offer for our Munch Bunch listeners. To book a virtual consult with Megan, she's offering a discount of $25 off. Just email her, Megan, at nwmyofunctionaltherapy.com or through her website, www.orofacial-myology.com. To book a virtual consult with Kimmy for the $25 off, email her mouthmusclememory@outlook.com or through the website, www.mouthmusclememory.com. Now on to the episode.
Hi, everyone. Welcome back to the Munch Bunch podcast. I'm Megan Van Noy, myofunctional therapist, dental hygienist, and I am here with my co-host, Kimmy Nishimoto, myofunctional therapist, dental hygienist, one of my favorite people in the whole wide world. And today we are actually completing the trifecta of my favorite people. And we have on actually my patient care coordinator for Northwest Myofunctional Therapy, Seini. You guys have probably heard a lot about Seini. She is actually coming on to share her story about her recent jaw surgery. So double jaw surgery, Seini.
Yes. Yeah.
Has been through the gambit. So she's going to share her patient side of things. And she actually has a pretty unique look because she's a patient, but now she also works on the back end, talking with our patients and working with our myo patients to get them started in treatment. So we're so happy to have you, Miss Seini.
Thank you for having me. I'm so excited we get to do this today.
Yes, I know. We're letting you take a break from, work to, do fun work now. Fun work.
Yeah.
Okay. Gosh, where do you want to start, Kimmy?
Tell us about how you felt before you started doing myo and before you even decided to go jaw surgery. Like, tell us what your symptoms were beginning and kind of the steps that led you up to that, because that's a really hard one for people to sign on to jaw surgery.
Oh yeah. So I'm gonna rewind back to about 2014. My biggest thing that was happening was that I was having lots of ear issues. I constantly had lots of drainage come out of my ears. I was constantly bleeding. There was lots of pain, always radiating over here, back of my head, down my shoulders. It would cause lots of tension headaches everywhere. Um, and the biggest thing was like, I am in so much pain right here that I can't function. And, being a mom of 3 children, trying to function as a mother and as like a wife and regular Seini every day, it was extremely difficult. And, I have a lot of high pain tolerance, but then when I get to that point where I'm like, okay, I can't function as a person, there is something wrong. So that took me on to, okay, well, I have absolutely no idea what I'm doing with my ears. Every specialist, keep in mind, I've worked with every specialist for an ENT, since the age of 7. So I've gone through many different
Mm.
ENT specialists. All of them just said, oh, well, there's you have chronic ear infections. You're just going to have to deal with it as you grow up, and it's not going to be a problem. Blah blah. Well, it's a problem, but it's not going to be something that you can fix. And
Mm.
so, I just had this really heavy burden of feeling like I was not going to be able to find a cure. And I remember some lady, she had actually been over here in La, she had gotten a type of cancer. And she was like, you know what? I'm going to figure this out and I'm going to heal myself because I want to. And because I feel like there's a way that I can do it. And after hearing her, I thought to myself, why can't I do it? Why can't I solve my own problems? Why can't I research? Why can't I do the work to find healing for myself?
Mm.
So that started into the journey of, okay, what's around my ears? What goes on over there? Oh, okay, well, your jaw is next to your ear. What if it was like something to have to do with jaws? So I started YouTubing, and I came across a myofunctional therapist, and it was talking about how um, the function of the jaw and the ears, they coincide together, and possible symptoms of ear symptoms and things like that could actually be issues with your jaw. So from there, I dove deep into figuring out what she was doing. She was talking about myofunctional therapy, and it really intrigued me. And I actually contacted her and said, hey, I want to know, is there a possibility that all of these issues with drainage could be actually from like dysfunction of the tongue and my tongue tied, that kind of thing? It ended up being yes, I was definitely tongue tied. And from there, everything just kind of snowball effect. Everything led into
Mm.
another, into another, and into another. And started myofunctional therapy. I went to go get my tongue released by one of the doctors over here, and he told me no. And I was completely heartbroken because here I am thinking, okay, well, if I
Wow.
I release, like I'm going to have so much relief and I'm going to be able to function properly, right? But bless his heart, I appreciate him so much. Now that I think about it, like he took the time and he really said, I don't feel comfortable. When a doctor tells you that he doesn't feel comfortable, he's an honest doctor and you should probably
Mm.
be doing that. So he said he wasn't comfortable with it. And I kept asking him why. And he's like, I'm looking at your structure, and your structure, he was hesitating between, if I release your tongue, are you going to have enough space? Are you going to be able to breathe? And if you have sleep apnea, am I going to make it worse? What's going on? So then he took my case and he actually presented it to a couple of different forums of doctors who also gave him counsel, and said that the biggest thing for me is that I would definitely need to have double jaw surgery. So from there, it just kind of, I don't know. Like at that moment, it was so much as a patient. You're like, I just came in for a tongue tie release and now I have to do MMA. Like, what the crap is going on?
Yeah.
There's so many.
Yeah.
And so, and then it's hard to digest because you go and you're like, okay, no, I'm fine. But the person that I am, I'm like, okay, well, if this doctor says no, and he says expansion and surgery, why would he say that? And so being curious, I dove into researching more about like appliances. I went through like looking at the Alpha appliance. There was also the DNA appliance that I was looking at. There was also
Mm.
like he was also mentioning like maybe doing appliances for pulling the jaw forward so that I could sleep better at night. All of the
Mm.
options, all of the options. So um I didn't feel like I wanted those, like this is,
Yeah.
because
Mm.
he was honest. He was like, at the end of the day, he goes, I'm just being honest with you. It's just going to band-aid your symptoms and it can temporarily fix, but because your structure is damaged and your structure is really bad, you're going to need to have surgery. And then so that was definitely echoed on and on throughout that whole situation. I hope I'm going like in the direction that you're wanting. Like this is
Yes, it's perfect. Yes, the
okay.
storyline.
Yeah. So I don't know. Do you want to hear how I ended up into surgery? Like how life happened with that? Like, wait. So yeah, go ahead. Go ahead. Give
I'm
me.
curious, like on your end, were you like offended? Like,
I,
did it make you mad when they said like, oh, structurally, like your bone structure is not ideal and you got the retrognathia, the tucked back chin?
yeah.
Sometimes we get like a little defensive about that. I'm just curious, like, did you have any of those like human type feelings?
Oh yeah. I was like, well, there's something's wrong with my face. Like,
How
I'm like,
dare you speak of my face this way?
yeah. But and it's funny because looking back on it, people would tell my mother all the time, like, hey, she's got a really small chin. Like she's got a really tiny chin. Are you gonna do anything about it? My mom's like, what do we small chin, what do I do with it? Like, what about it? Like nobody knows that, there was that tongue tie there, or that I had actually had arthritis in my jaws. Like nobody knew all of this stuff.
Right.
But yes, it's kind of that feeling of, okay, like I understand that it's not symmetrical. Like I understand that it's far back, and it's like, well, I mean, this face got my husband, so I mean, I guess I'm cute. Like all I cared was like, well, at least I'm cute enough for my husband. Like, okay, but and then it was like, okay, I'm not too offended, because at the end of the day, they're just like, I want you to breathe better, I want you to sleep better, I want you to eat better and thrive. So I, really had to digest that it was coming from a good space.
Yeah. Yeah.
Thank
I
you for
know.
sharing that.
Yeah, I know it's hard. It's hard to talk about, and people don't want to talk about that emotion that you go through, but acceptance after being presented with facts, I feel like that's an important thing for patients to realize, is like, you're going to have emotions, and you're going to feel, you may feel offended, and it's okay. It's just looking at
Yeah.
the logical side and the facts of it. So yeah.
I'm curious, Seini, do you know what your the airway scan that we talk about all the time is CBCT or cone beam is how we digitally measure the head neck and the how much room you have on the roof of your mouth, and anatomically, like you can digitally measure the airway. Do you
Yes,
know about how much airway space you had?
I do. So we ended up getting like a CBCT scan. We sent it out to UCLA to see how much airspace was in there. Um, Let me see if I can pull it up real quick. But it was pretty bad. It was enough that there's also the upper airway resistance. They were like, oh, you can do the CPAP. I don't want to sleep with a CPAP, but let me
In
see
your
if
20s, trying to sleep with a CPAP, like that's not.
I
I mean, it's not the dream at any age, but like especially like when you're like in your most youthful years and you're like, I can't believe I need something like this to help me through. And
right? And you're like, I can't, well, it's so attractive while you're sleeping, right?
oh yeah.
Yes, it was not very good. I remember, there's like the red and yellow gauging in between it. It was like red yellow-ish
No
area.
greens, no greens,
No green,
all red, yellow.
no green, no green.
Yeah. So we wrap our head around, okay, fine. I have arthritis in the joints. I'm gonna need double jaw replacement surgery. I'm going through this process. I have this tongue tie. Okay, what do I do next? How do I do it? What comes first? What comes second? Like, what does this even all mean? So, gosh, is this about, maybe not quite yet? Is this kind of close to the time where you and I met at this point then in the story?
So that's another thing that I really appreciate Dr. Coppelson for, was that no, we haven't met yet. I
Okay.
haven't moved to the mainland to do surgery yet. But it was right after that kind of whole snowball effect that I ended up being on the mainland and saying, okay, I need braces. I need expansion, because I understand now, like 100%, why it's important. I've done all of this research, done my homework. And I went in to see a jaw surgeon in Tooele, and he goes, yeah, you're gonna need a specialist for your jaw surgery. I was like, I don't want one. Like, a specialist is gonna be more out of pocket. What am I gonna, okay, how am I supposed to do this? So I was actually looking for a surgeon that would take on my case because I had so much damage over here that it was supposed to be a total joint replacement. So they would have just cut everything down here, pulled the whole thing, done all the wonderful extra stuff. So after I moved to Utah and after I had that consultation with the jaw surgeon, that's when I met Megan and we were working together. And then I flew over to LA and met Dr. Zaki, and I had a consultation with my surgeon, Dr. Coppelson, on that. And then the I feel like it's important for patients to know is that, like, the reason why I chose my doctor, Dr. Coppelson, was because I remember in our consultation, he was like, he was like looking at my case really. I've never had somebody like intensely stare at my face, like, it was so fun because, I saw Dr. Coppelson and I could just see him processing everything. And and then at one point he just lit up and he's like, oh, I know what it is. I know what you have. And I go, what do I have? Like, what? Like, what do I have? He goes, no. He goes, I know what this is. He's like, I did a research paper on this when I was in college, and I've done this when I was like, I've already done something like this. And he went through and he goes, you had arthritis when you were younger and it destroyed your joints, and this is why you developed this way. And it was like
answers.
the first answer, you guys, this was like the first answer in 29 years after so many specialists, after like relapse in ortho, the whole thing. And it was, right then I knew, it was like, watching him solve the problem and then give me an answer. That's the kind of surgeon that I want to have if there's a problem. Yeah. So if I knew I could trust him with any problem that may occur.
Yeah. And so just to clarify, it's Dr. Kevin Coppelson. Kevin's his first name, Dr. Kevin Coppelson. He's based out of LA. He has surgery privileges a handful of places, which Seini can speak to better than I can. Yeah. And then he collaborates with a few other airway people that we also work with a ton, like the Breathe Institute and Dr. Zagi. Oh, yeah. And so that's kind of all of those connections. So yeah. Okay. So Kevin was like, yep, let's do it.
Let's do this. He's like, oh, and then that same day, Dr. Zaki is like, hey, you want a tongue tie release? And I was like, are you sure? He's like, yeah, let's go. Whipped in me in that office, and he was like, oh yeah, like, and then we did my tongue tie release, and I remember I was like, oh, just the tongue tie release for me was such an emotional journey. Just that relieved so much pain, and I remember describing it as, it's the first time I've ever felt relief. Like, that really was the first time I've ever felt relief. Yeah. And I could say, hey, I know what relief is. It's not like medicine, but like actual relief from pain. So that was the first marker of like, hey, I know what relief is. So
yeah. And I remember talking to you on the phone afterwards, and it almost kind of mirrored the conversations Kimmy and I had around her tongue tie, of just that like emotional release. That was so cool and just so, like, I don't know, beautiful is like a lack of, I think, is really what it comes down to. Just to be able to breathe, to be able to open up, it's different than my tongue tie story, right? Because, I was pregnant and throwing up my entire week of getting my tongue tie relief. That story is different because I'm insane. But that just, and I just remember getting like teary-eyed talking to you about it too, because I'm just like, man, this is so cool. Like, we're really finally making waves, making moves, going the right direction, like making space for that healing, which I think was really cool.
Oh yeah. I like to kind of, now that I think about it, when you're lifting like heavy weights and you've got like 150 pounds, and it's like you've never taken it off your shoulders before, and you walk around with like a whole bunch of weight, like 150 pounds extra. When he released that tongue tie, it was like it finally fell off my shoulders. Like all of that weight
Mm.
finally, and I finally get that the weight comes off your shoulders, but it was more of like that physical relief as well.
Yeah.
I think that's an interesting point because sometimes like we get a little too hung up on tongue space lately, where it's like you knew that you needed to have jaw surgery, but you also had this tongue tie, and then one person said no, but Zoggy, who is the ultimate
Yeah.
the
guru.
leader,
The one who kind
the
of coined,
guru.
yeah, and he kind of coined that tongue space, right? Like he coined that research, the 2019 laryngoscope, 348 cases, 2 got worse, 1 because of the tongue space issue. That's who we really focused on, seeing they could do better. You know, like he's kind of the one who started talking about tongue space to begin with, right? Like that was 2019. So the like 3 years I was even practicing myofunctional therapy before that, that was not a conversation we were having. So, you know, 3-4 years before we even had that tongue, you know, tongue space conversation. So, and he still released yours, even knowing
Yeah.
that this was coming, right? Like,
Well, and by then I hadn't said yes to doing things with Dr. Coppelson. He was like, let's do it. Let's look at your tongue. Let's do this. Let's get a release. Let's be it. I was like, oh, like, all right. Like, but it was, you know, the one thing that I was really hoping for me, like for me, I was hoping to have that type of release and relief from it. And it was such an emotional and physical response to it. And I remember he had the like the O2 monitor on, and my heart rate started going up so high. And he's like, "Are you okay?" And I go, "Ah," you know, and I just start tearing up because I'm like, I have no idea why I'm just feeling a little wonky here. He's like, "Okay, well, we're just gonna, you know," and then he went on to explain like why it's important to take a break and it monitor heart rate, everything like that. It was a very cool experience and a very big learning experience for me as well.
yeah. And let me jump in here, you guys. She did not do this without having some myo prep. Okay.
That is true.
Doctor,
That is very true.
like everybody, like pause for a second. Seini and I had been working together for at least 6, 7, 8 months at this point. So her myo was dialed in. Dr. Sagi didn't get all willy-nilly with it. Okay.
No, he didn't. And keep in mind, he was like, I want to see your suction. And it was bam, like it's up there. So yes, I did not do that without doing myo first.
So just like nobody, you know, nobody get too excited, okay?
Don't get too excited. No, you got to do your work. You got to put in the work in order to have good results.
We want to introduce the Spot for Tots course, a parent's guide for toddlers ages 2 to 5 for mini myo. We have Megan and Kimmy going over nasal hygiene, myofunctional exercises, breathing exercises, tongue tie healing protocols, and then we have Jenny June going over sleep hygiene and Kelsey Baker going over feeding therapy and body work. The course is $297 and the link will be in the description.
Yeah. And so then it's about 6 months later is when you got the surgery.
So we were supposed to do it 7 months later, like August area. That was like the tentative plan. August, September, October. And then we had to wait till October-ish. And then we said, okay, no. And then planned it out some more. And then December is when I got it. So about, 11 months after. Yeah, 11, 12. Yeah. I'm like, no, it was a while. It was, so that, So it was almost a year after the tongue tie release that I finally had double jaw surgery. So
how was that year in between your tongue tie release and when you had the surgery? Was there an improvement, like incremental improvement, or was it pretty drastic and then the surgery, once you healed, was the cherry on top? Or how was that gap year?
it was actually, because there was so much more relief, I could function more. But I would have to say, looking back on it right now, there was a lot less pain compared to what I would have had to deal with. But there was also changes in my physical structure. And then
because you're going
that
through the expansion.
yeah, so the expansion pain and the pulling back my teeth pain was kind of like gapping that pain that I used to have with the tongue tie and the tension here. The tension wasn't bad here compared to what prior and before, but the pulling and the cutting off my ear more and making it pretty much everything worse in place for surgery, that was really painful and emotional. That was not something I could do on by myself. So that year prepping was difficult. I'm gonna be honest. It was hard, and there were some days where it was just it was just painful.
Okay, so then we went through that year, we got you prepped, we were hoping it was be sooner. There was a part of it, you guys, was like all kind of the post-COVID stuff. Like this is all 2020 time frames, 2021. Yeah. And so that's kind of why things got pushed around so much too. So, okay, so we finally get our surgery date. We go into surgery. You flew to Texas.
Flew to Texas, went to Houston Methodist, and got surgery. I'm like, honestly, that was the easiest part. The easiest part was getting surgery. I'm gonna be honest. Like people think it's like the worst thing, but it was the prep was more emotional and more of a difficult thing to bear physically than having to heal from surgery.
Yeah. Yeah, definitely. And so went through the surgery. How long, do you remember how long the surgery was? How long it took him?
Yep. So I was originally only supposed to be in surgery for 5 hours. Ended up in surgery for 6. Then came out pretty okay, but then I started to balloon.
Oh yeah.
Got really swollen there.
A little plump for a bit.
little a lot plump, which is okay,
Yeah. And then how long till you were even able to open your mouth again?
I mean, wide.
I think you just opened like
part of me was just like, because I don't know if you noticed, and sorry, my nose did. When I first came out, I was like, oh.
Yeah.
And I remember Dr. Coppelson came in, he's like, you gotta close your mouth, like close your mouth. But to open to eat, I would say I was trying to eat some like ramen noodles week 3, and I just stick it in and just kind of vomit out. Because it was so, if you make your noodles like super slippery, it just like slips on down. So I would say, but to like fully open and bite, it was about 3 months. So that
3 months. Oh, wow.
Yeah. The stabilization, getting the like muscle fibers to reconnect, getting things to work like simultaneously again. Like even you had some asymmetries, like one side was working better than the other for a bit. It's been kind of a crazy kind of post-op journey.
Oh yeah. Well, and then because he did everything intraoral, everything was like cut out, and then I'll have to remove some of the muscles that were on the side. And so that learning how to chew, it was completely new. And swallowing, of course, because now I have all that space as well. My tongue was like, well, how do we swallow water? How are we swallowing food? Are we using the back of the tongue? And I don't know if you remember, Megs, when I was telling you, I'm like, I feel like I'm gonna gag. Like I had some
gag was bad.
Gagging reflexes that were happening because I was just hitting the back of the roof and my tongue was hitting the back, and it was just like, this is new. And my tongue hadn't been stimulated before, and my mouth hadn't had that stimulation before.
How long were you bruised for, Seini?
Oh, I want to say I didn't bruise that bad.
I don't remember a ton of bruising.
I used a lot of arnica on there, so I wasn't badly bruised. I would only say about 2.5 weeks max, through like 3, only because it was more a lot of swelling, not lots of bruising though.
Yeah, the swelling. Yeah, and actually let me share your before
Yeah.
and after. So
This is the most exciting thing in the world.
Mhm.
Dang.
Yeah, so
Yeah, I remember. Like,
before, okay, just so everybody knows, the before, like Seini, no chin, poor baby. But still gorgeous eyelashes. Let's talk about
thank
that.
you. Thank you.
You know, but and then look at how much more room, like see how much like the nose is off from like where the chin should be versus now. It's just like, well, bam. So, and
Yeah.
then I'll pull up the other side.
Yeah, and so that first one in the purple, that was my first consultation where I had just had a bunch of ear issues. And then the second one, the second slide that we're about to see, that is right before surgery. And so everything is really pulled back and everything's getting aligned to actually move my jaw forward.
Mhm. Yeah. Yeah.
Yeah. I cringe. I cringe. Not because I'm like, that's hideous. I cringe because I remember the amount of pain
Yeah.
in that one. I'm getting emotional. I'm like, I remember the amount of pain that came with
Yeah.
that prep and that
Mm-hmm.
mental toughness and working through and needing like all the support. That was hard. It was
Yeah.
hard.
So hard. Yeah. And then, you know, you and the kids were living in Utah, your husband's back in Hawaii. Like there's so many moving pieces. Like, you know, I had just had Isabel. Like
Mhm.
sometimes Sandy and I like to say that we trauma bonded, you guys.
Yeah.
Yeah, and that's why we're so close these days. But yeah, so and then so what they don't see in that picture is you still had on your braces.
Yeah.
And obviously, if you're watching this versus listening, you can see Saini's got this gorgeous non-brace face smile because we've completed. So still ortho for another few months after, and just recently got the braces off.
And that was it. I was not expecting my face to look, or my mouth or my teeth to look the way they look. I'm so used to having like teeth that look like they're too big for my mouth, and like people commenting, I have such a tiny mouth, you know. But then to be able to have like a full functioning smile and teeth that are aligned so I can properly chew, it was, of course, emotional, and I cried and definitely, you know, but I'm definitely thankful to have a healthy mouth with good teeth and being able to breathe.
Yeah. Yeah, it's so cool. It's such a cool story. You know, it's so hard is there's not a lot of protocols around this. We're, as myofunctional therapists, we're asking for this all the time. You know, Sandy and I are kind of putting our heads together because we have now worked together through this of creating some protocols ourselves because it is such an emotional journey. It is such a physical journey. Like there's every piece of the puzzle to it. And it's a big deal. And, you know, Saini, I hope you don't mind me sharing this, but, you know, she catches people staring at her face a lot. People who knew her before, people who know her now. She's like, people just kind of stare at my face.
They do. Well, and you know, it's funny because the people I knew before, um, it takes them a couple of minutes, like it takes them a couple of times of interacting with me to like really grasp, okay, now I get why she had surgery. It's just like, oh, like I didn't realize that that's where she should have grown in the first place. Like I didn't realize that she had so much pain and trauma that it was causing that dysfunction. Yeah.
Yeah.
It's so funny because I've always thought you were just darling. Personality, spirit, soul, face, like just so cute. But now you've had your surgery, I'm like,
Model.
damn.
You guys are so sweet. Like I feel so honored. You know, looking back on it, like I feel so honored. You know, I have this space now and I want to use it for good. And I want to be able to express to people like, you know, there are ways to solve your problems if you know, and you can do it. It's just like I feel honored that my space is allowing for people to have a conversation.
Yeah. Yeah.
And I'm like, a conversation for good.
Yes, conversation for good. We're going to save our evil schemes for later, for other things. And actually, Seini, she documented her whole journey on Instagram. It's Seini's choice, right?
Yep. Seini.
Yeah.
It was my choice to take life and do things for myself and to heal myself. And so I named it specifically. It was my choice. So it's Seini's choice of what. So I can take responsibility for my choices as well.
Yeah. And I love it. And I love it so much. So you can check out Seini's story on Instagram at Seini's Choice. You can also check out some of Seini's posts. She does all my social media, you guys. So, at the NWMFT, if you've been liking the posts lately, that's because Seini's been making them.
So cute.
Yes, and Seini, it has kind of a unique spelling. So Seinis Choice. Okay. And of course, she's linked through all of our pages too, and you can find her there. You can find Kimmy at Mouth Muscle Memory, and you can find me at NWMFT. Of course, email, reach out if you have questions about your jaw surgeries coming up. Any of us can help answer and guide you guys that right direction too. So, like we said, we're going to use it for good, and you really spread the word, spread the message, and offer support to others.
100%.
Awesome. Well, we will catch you guys for our next episode. We've got some, like I've been saying lately, I feel like at every end of episode, I'm like, we've got cool guests coming, and it's like, it's just nonstop. We've got cool stuff, and we do. Like, we've been so blessed lately with all these people and all these guests, and I just can't be like any more thankful. So follow us, the Munch Bunch Podcast. That's where you can also find us on Instagram and on YouTube, Spotify, Apple, Anchor. If it's out there, we're probably on it. So Kimmy, I love you as always. Seini, same. It's been one of my favorite episodes because it's two of my whole favorite people. So we will catch you guys soon.
Thanks, Seini.
Bye, guys.
Bye.